bugs everywhere that will get into the ear, and if they get into waterlogged skin, which is, there's no barrier at all, then it will just take off. And it's usually staph and strep. Now, people say, oh, I heard that it was Pseudomonas. As far as acute otitis externa, I think you can forget about Pseudomonas, acute. Now, chronic, it may be, but not an acute otitis externa. It's usually common strep or staph. It breaks into the skin integrity and does this. So the secret is treat it, make sure they have something for pain, follow up just to make sure there's improvement and there's not debris further down that you weren't able to see because the ear was so occluded in the process. And again, we can cheat with the microscope and look into the ear after there's some resolution of this inflammatory edema of the canal. We can look in there and see. And then try to find out a cause for it. Here's our old friend, a foreign body. See that piece of gravel down in the ear. Now, what I want to demonstrate here is you see the canal wall bulge, and it's beyond the canal wall bulge. And that foreign body is there. It's not so big that it wouldn't come out through this narrow spot. So the ear canal comes in, it narrows, and it widens again. See, there's the anterior canal wall bulge. And further down is that little valley called the sulcus. And there's the foreign body. Well, all this area is super sensitive because it has numerous sensory nerves in there. So removing that, if one is careful, it can be done. But the problem with removing foreign bodies, particularly in people that aren't very cooperative in children, is you don't have good magnification, you'll invariably traumatize the skin or push that in further and injure the eardrum. I've seen that happen. So, and sometimes the foreign body, let's see if we have, well, this ear has been this is a big stone right here, but they've been fussing in that ear and they've got all this skin irritated. Now, depending on the size of that foreign body, because remember, it goes into the ear, and if it slips through the narrow spot and it's on the other side, you're going to have a devil of a time getting it out. And so we have to anesthetize the ear to get that out. And in children, if there's any question that it's a sizable foreign body, they have to have an anesthetic to get it out, because they're not going to tolerate it. Neural damage, with a violent motion, you can push something and tear right through the tympanic membrane, without any doubt. Foreign bodies don't irrigate well in the ear, so I'm not one for irrigating. If it's there, I wouldn't even try to remove it if the child is not cooperative. An adult, you can, but children, entirely different, aspect of care. Now, you might say, well, what is this? Well, this is someone who's had an uncomfortable ear, not real pain, just an ear that likes to drain a little bit, and it's been going on for some time. See if I can demonstrate something. You can see some of the eardrum way down here, this nice gray structure. You can see a little bit of the malleus. But out here in the ear canal, you see this chronically inflamed skin right in there. Looks like it's ulcerated. Edematous and ulcerated. This canal wall here doesn't seem to be too bad. And this has been present for some time. And they may have been given maybe some local ear drops. It didn't get better. And it goes on for several weeks. And you look in the ear and you see this. And particularly if you see this in someone who's a little bit older, who may have some other comorbid conditions, then this could really be one of these chronic Pseudomonas otitis externa. And they can really be a bear cat. And they're usually older people who might have diabetes or other comorbidities. And they don't respond just to some topical ear drops. they don't, or there's no reason to put a wick because you can see the rest of the other part of the ear canal. These people need to be treated with one of the ciprofloxacins by mouth for a long period of time until that gets cleared up. Because technically, if it's chronic otitis externa in someone who has other health issues, you can end up with not only an inflamed bit of skin, but an inflamed bit of inflammation within the bone structure of the ear canal. It can really be a devil. And that's why years ago when this was first written about, they used the word malignant otitis externa because it was such a persistent infection and had so many local ramifications in trying to remove that infected debris in there. Unfortunately, with the antibiotics that will treat Pseudomonas, it's generally effective in clearing up this. But it's usually someone who's older, who has other issues, and you see this sort of picture in the ear. You have to think of that chronic otitis externa.
What would you use if they have the? Because I feel like more of the older patients, not necessarily that it's a true allergy, but it's listed often on our allergy list as the fluoroquinolones. So what would you use in lieu of the Cipro or even like the levofloxacin? Could you, like doxycycline, take care of the?
Well, you could. If I really think it's an elderly person who might have this condition called chronic otitis externa / malignant, I think those are the times when you say, well, you know, I'm going to involve the infectious disease people. Because years ago, before we had ciprofloxacin, these people were hospitalized and treated with IV antibiotics.
Wow.
And went on for a long time, believe me.
So how long would you expect before something like that would clear up? Months?
I'd treat them for 3 or 4 weeks easily. They can tolerate Cipro, I would. And then you need to have them come back and look at the ear and clean a little bit and just kind of see what improvement they're having. And be mindful of, pain, not acute pain, but just this sort of aggravating, annoying, troublesome pain. I would try to get everybody involved with the care of those people because it can be a long drawn out process. It can. Well, here's an ear that, there's people love to clean their ears out with pencils, and that's a bit of lead debris on the skin. It's like they tattoo their skin. Now, here's what happens when you try to put a Q-tip in the ear. Now remember, the ear canal has a narrowed segment because of the anterior canal wall bulge. So they have a Q-tip, they're fooling around the ear, someone pokes their hand, and they end up with a lot of pain, and they pull the Q-tip out and there's blood. And they come to see you, and you see blood in the ear canal, and the question is, did I break my eardrum? That's the question. You might look in there and not be able to see the eardrum. They may have just scuffed up a bunch of skin, and the bleeding is coming from this skin that's scuffed up in here. And so they don't all break the eardrum. If there's a lot of anterior canal wall bulge, they're going to encounter that before they encounter the eardrum if they're using something that's wide enough that can't get through there, or if there's pressure against that canal wall bulge. So not every individual who has a Q-tip injury or any injury to the ear with something foreign, they break their eardrum. Now they can, but then you're on the spot of trying to explain to them, did I break my eardrum? And the ear is just filled with blood. So I think it's best to say, well, there's blood in your ear. We're not going to wash it out. Why don't we just leave things alone? And I wouldn't necessarily, if it looks like dry blood, my philosophy is I wouldn't give them any drops or anything. Say, keep this ear very, very dry, and we just want you to come back here in a week or so just to look at the ear to see if we find just dry blood there, or maybe get a glimpse of the eardrum, or if you're in doubt at that point, say, well, I think we need to get that dry blood out of there, but I'm going to have someone else look in there with magnification see what it looks like. Now they don't all just lacerate the skin and have blood. You can damage the eardrum. There's a good example. Nice hole in the eardrum from someone fussing with their ear, and then you see all the blood, you see a tear in the eardrum. Well, obviously, if you see the actual hole, I think you have to be honest with people, say, well, the eardrum's broke, and there's blood there, but the eardrum has a great deal of reparative power, and they're going to wonder, are you sure it's going to heal? Well, you'd say there's a good chance that perforations heal if it's obviously, to your way of viewing, if it's certainly less than 25% of the eardrum, and the eardrum has never been injured before, there's a very good chance that it will heal on its own. Surprising. If it's a large perforation and it's an ear that's had some scar tissue from infections as a child, maybe the likelihood of repairing itself on its own spontaneously is diminished. But I wouldn't remove any blood, wouldn't do anything like that. Just leave things totally alone, and just sit on your hands and do nothing. I wouldn't do anything. Now there's a little tear there in that eardrum right there. And that can be from someone getting slapped against the eardrum with someone's hand, or breaking an eardrum with some sort of altercation where the eardrum is struck like that. It could also happen with skiing. If you fell over with a great deal of force into some water and drove water under pressure against the eardrum, you can tear into the eardrum. Now, if we see it from just a slap on the ear, and you come and they say, oh, my ear hurts a little bit, there was a little bit of blood, I just don't hear real well, and it looks like there's nothing in there that's the least bit infected or anything, we have the advantage of looking with magnification. We'll just cover that hole with, I may have mentioned this before, with something that's very novel, and it's called cigarette paper. It's a simple piece of thin cigarette paper that people roll cigarettes with. And we keep a little box of different sizes, and we put it over the top of that. And if you put that over, they'll say, now I can hear again. Well, obviously you can, because you covered the hole up. How effective is that cigarette paper? It's surprisingly effective if there's no infection in there. It acts as a lattice for the ear to have something to kind of, quote, grow on, unquote. And so we won't do anything. Just put that in there and leave it there, and maybe not look again for 2 or 3 weeks, see if it's resolved.
So you never actually remove the paper, it just sits there
Yeah,
all around it.
See, once again, remembering that the skin, first layer of the eardrum is skin. That skin sheds microscopic dead skin cells called squames. They literally come off and they migrate out of the ear. Hard to imagine that. There are hundreds of dead skin cells that migrate. All the ones here in this canal, all this skin here has to desquamate. It's the nature of skin everywhere in our body. It has those layers that you read about and are quizzed about with, in tests. The last layer is stratum corneum, and it fragments off, and it comes out in little skin cells. You don't even know it.
I have a question though. I saw a 3-year-old that had congestion, cold symptoms for several days until they started complaining